We'll now look at the physiology of blood. So, uh, what we have got to realize is that blood is a necessity for the preservation of human life. Blood is critical for the transportation of nutrients, hormones, gases, and waste around the body. It also has important immunological functions through the cells, of course. And blood is critical in the hemostatic regulation of the pH, temperature, and various other internal conditions. Blood is composed of plasma, platelets, leukocytes or the white blood cells, and the erythrocytes. This we have just seen in anatomy. An adult human has about 4 to 5 liters of blood formed of cells and plasma circulating inside the blood vessels. So, plasma forms about 55% of the blood volume. The other 45% comprises of the different varieties of the cells. So, the total blood volume of about 7 to 8%, total blood volume is about 7 to 8% of the human weight on a normal healthy adult. So, when again we are looking at the blood plasma which we have seen, this plasma has 90% of water, 9% of solids such as coagulants, plasma proteins, and the other this thing as reticuloendothelial cells of the liver, or electrolytes, immunoglobulins, hormones, and other things. These are circulating inside the plasma. So plasma is a medium for transport. In the embryonic stage, blood plasma is formed from mesenchymal cells. The albumin is formed first, followed by globulin and other plasma proteins. And in an adult, when you see, the reticuloendothelial cells of the liver are responsible for plasma production. This is important. Plasma production, the RA cells of the liver are important for plasma production in the adults. This process is aided by the bone marrow and the spleen. So, the liver, bone marrow, and the spleen are responsible for plasma production in the adults. This has got to be remembered. And the functions of plasma. We've just had an overview of that. Blood plasma has various vital functions. Coagulation. Plasma contains fibrinogens and procoagulants such as thrombin and factor X. These are very important in coagulation. And immune defense. Plasma has immunoglobulins. Now you would have heard about immunoglobulin therapy in various conditions, treatment of various medical disorders. So plasma has got immunoglobulins that are antibodies as such that play an important role in the body's immunological defense process. Maintenance of osmotic pressure, that is very important in this thing. The presence of plasma proteins such as albumin, which is vital in maintaining a balance of fluid called osmotic pressure in blood, maintained at around 25 mmHg. This is the osmotic pressure of the blood. Acid-base balance. This is again very important. Plasma plays an important role in acid-base balance also. Plasma proteins help in acid-base balance through a buffering action. Then transportation of nutrients and waste as such. When you see nutrients such as glucose, amino acids, liquids, vitamins are transported in the blood plasma from the digestive system to different parts of the body for utilization. And transportation of respiratory gases, oxygen during inhalation to various tissues, and the waste product, carbon dioxide, and eliminated through the lungs. Transportation of hormones also occurs through the plasma. Excretion of waste products from extracellular metabolism are carried within the plasma, and they are excreted via the kidneys as urine, lungs, and skin. Lungs as air, carbon dioxide in the air, and then skin as sweat. Transportation, then when we come as temperature regulation, plasma plays a very important role in temperature regulation. The erythrocyte sedimentation rate is used as a diagnostic tool. ESR na paponama. ESR is a diagnostic tool. As fibrinogen increases in acute inflammatory condition, the ESR will also raise. So when you say acute arthritis and acute various other those things, the ESR can be raised. So a physician, when he looks at the raised ESR, with the symptoms, with the sign, other the thing, examining below, it will help in coming to a diagnosis. When you look at the erythrocytes, these are the physiological functions. Erythrocytes, known as the red blood cells, are biconcave discoidal cells. They lack a nucleus but contain hemoglobin. The red cell iron-rich protein carries oxygen is hemoglobin, and are surrounded by a membrane of lipids and proteins, as we saw before. A normally healthy adult produces about 119 million red blood cells per second. 119 million red blood cells per second, a normal human being produces. So that is why when some patients say, "Sir, blood at the tongue," they have withdrawn so much of blood, 5 ml. It's nothing. It is regenerated very fast. That is why when you are giving blood donation, when you look at that, I am weak, this thing, nothing happens. It regenerates in a normal healthy individual. So the single erythrocyte cell lives only around 120 days. And in that duration, it performs successive roles. One is oxygen delivery from the lungs to the peripheral tissues, all the tissues, including heart, kidney, whatever you say, and collects carbon dioxide from the peripheral cells and returns it to the lungs, through which they are excreted. RBCs contain hemoglobin with ferrous heme, that is Fe, ferrous heme, which has an affinity for oxygen, that is absorbing oxygen. When it arrives at deoxygenated cells without oxygen, this Fe loses its affinity for oxygen. It releases oxygen into the deoxygenated cells due to decreased partial pressure of oxygen and low pH in the cell. When you look at leukocytes, WBCs, the physiology rather, not pathophysiology. Leukocytes are the cellular components of blood, also known as white blood cells, that we have seen. They have a nucleus and lack hemoglobin. The WBCs form 1% of the total blood volume in healthy adults, and they are considered to be an important part of the immune system, like we spoke some time before. The leukocytes are produced in the bone marrow in a process called as hematopoiesis. Hematopoiesis is something which can be, we'll deal with it later on. And the normal WBC count ranges from around 4,000 to 10,000 cells per MCI. Types and functions of WBCs. So what are the types and functions? You know, various types of WBCs are the leukocytes, eosinophils, basophils, lymphocytes and monocytes. So the neutrophils are the WBCs that are released from the bone marrow. They represent around 50% of the total WBCs. Around 100 billion of neutrophil cells are produced every day. 100 billion cells, can you imagine? God alone knows how this is happening from the marrow. That's why we say that we are nothing. We human beings are tools. We don't know the basic how things are happening in our body. How to manipulate that and then maintain is something which we have found out. First, that is why there's always a higher power running everything. So, when you look at the neutrophils are produced every day and they are considered to be the first line immune system cells. They are the major pathofighting immune cells that migrate to the site of infection, then identify and kill bacteria and viruses. Neutrophils also send signals to alert other immune system cells, complement and other things and all that. So they migrate to the site of infection and destroys bacteria and viruses. First line defense. That is why in acute infections, neutrophil levels are increased. Monocytes. When you see the monocytes, they represent about 5 to 12% of the WBC count. They are considered to be garbage trucks. That is for excretion, this thing, of the immune system, and play an important function in cleaning the dead cells and tissue regeneration. Cells which have died, bacteria, viruses, they remove that and then help in the tissue which have been affected regeneration. And eosinophils, when you see, they represent less than 5% of the total WBC count. They are found in large amounts in the digestive system. Eosinophils play a very important role dealing with invading bacteria and parasites such as worms. That is why when you say that eosinophils are raised, probably eosinophilia, allergic this thing, or worm infestation, deworm the patient. So in bacteria in the gut, lungs, sinuses and parasites. Then when you come to the lymphocytes are antibodies that give immunity to the body if the body is exposed to the same infection again. That is why we say when lymphocytes are increased, it indicates a chronic infection like tuberculosis or recurrent infections like typhoid, relapse of typhoid, those things you'll see the lymphocyte count increasing. So that gives an indication to the disease as such. It consists of two types of cells, the T cells which have an invading function and the B cells, which in contrast to the other WBCs are normal for humoral immunity, that is immunity associated with circulating antibodies, in contradiction to the cellular immunity. So this is important for the humoral immunity, you would have read, and the cellular immunity, immediate this gradual via various things helps in the innate immunity or the humoral immunity, the lymphocytes. The cells play an important role in developing a lot of the current vaccines. So when you're looking at a COVID vaccine, when you're looking at that, the messenger RNA, the lymphocytes are the target, those things from which things are looked at in producing vaccines. And the pathophysiology of leukocytes. From physiology, we are going into pathophysiology, which deals with diseases. Elevated WBC counts can indicate a variety of conditions: infection, inflammation, trauma, pregnancy, allergy, asthma, cancers such as leukemia, and even aggressive exercise. People going to the gym regularly exercising can increase the WBC count. You should not mistake it for an infection. On the other hand, low WBC count can also indicate certain infections, like bone marrow damage, autoimmune disorders like systemic lupus erythematosus, and splenic sequestration. More importantly, low WBCs, where you might find is very commonly seen is in typhoid fever or viral infections like COVID, like other viral infections. You see that the total WBC count can be on the lower side. If it's on the lower side, high grade stepladder fever, and other features, you think of typhoid or you think of other viral infections. And of course, the various autoimmune disorders, bone marrow damage, splenic sequestration, SLE and other types, which are fairly rare. And the formation of all these cells in the human body, this is something which is a bit complex and which has got to be explained in detail. I would suggest that you study this once from the basic stem cell, how the cells are formed. Every cell is formed from the basic stem cell. That is how stem cell therapy is coming into view. So, the general idea I'll give you. Hematopoiesis, blood cell formation, occurs in the red bone marrow in myeloid tissue. Erythrocyte production and formation of leukocytes and platelets are stimulated by hormones. Hemocystoblast, all the formed elements arise from a common stem cell, the hematocystoblast. Stem cell, hemocystoblast, hematocystoblast is the precursor of all the circulating blood cells. The hematocystoblast has two types of descendants. One is the lymphoid stem cell, which produces lymphocytes. The other is the myeloid stem cell, which produces the other classes of formed elements, like all the other blood cells. Formation of red, that is all the other leukocytes, WBCs. Formation of red blood cells, the entire developmental processes from hematocystoblast to mature RBCs takes about 3 to 5 days. That is why blood transfusion, when you are donating blood and all that, within a week maximum, this will be regenerated. 400 ml or whatever you are giving. Anucleate, that is without a nucleus, are the RBC cells, unable to synthesize proteins, grow or divide. So these cannot grow or divide, RBCs. They are produced, destroyed, produced again, this thing. They don't divide and this thing. The lifespan of WBCs is more rigid and begin to fragment, fall apart within 100 to 120 days. Lost RBCs are replaced more or less continuously by the division of hematocytoblasts in the bone marrow, reticulocytes. From there you get the newer red blood cells. Immature RBCs are seen when there is excessive bleeding, RBC destruction. You see the immature red blood cells in the bone marrow. And begin synthesizing. They start synthesizing huge amounts of hemoglobin, immature red blood cells, reticulocytes. Reticulocyte. When enough hemoglobin has been accumulated, the nucleus and most organelles are ejected and the cell collapses inward. So, நிறைய hemoglobin when it accumulates, the nucleus and the organelles inside இருக்கிறதெல்லாம் they are ejected. From the reticulocyte contains the nucleus, not the RBC. The immature cells they are ejected and the cell collapses, resulting resulting in young RBCs without the nucleus, but still containing enough endoplasmic reticulum to carry oxygen. Mature erythrocytes, within 2 days of release, they are rejected by the remaining they have rejected the remaining endoplasmic reticulum and become fully functional erythrocytes. Within a couple of days, containing endoplasmic reticulum, the young RBCs they reject the endoplasmic reticulum and become the regular mature red blood cells. Then erythropoietin, rate of poietin production is controlled by a hormone called erythropoietin. This is where mostly when you see in renal kidney failure patient, a drug injection for erythropoietin is given because that is formed in the kidneys usually, and they are deprived of this in renal dysfunction. So for anemia in a patient with renal dysfunction or failure, erythropoietin supplementation is given to produce increased RBC level and oxygenation. And only a small amount of erythropoietin circulates in the blood. RBCs are formed at a fairly consistent rate. The control of RBC production. Important point to remember is that it is not relative number of RBCs in the blood that controls RBC production, not the number of cells which control the production. So the control is based on their ability to transport oxygen to meet demands. So limited number of cells are there, they are able to transport oxygen, then the production is reduced. When they are not able, that is reduced number, then the production increases. In the human adult, the bone marrow produces 60 to 70% of the white cells or the granulocytes and all the platelets, bone marrow. The lymphatic tissues, particularly the thymus, spleens, lymph nodes, produce lymphocytes, which comprise about 20 to 30% of the cells. The platelets, which are smaller cellular fragments rather than complete cells, are formed from bit of cytoplasm of the giant cells which are called megakaryocytes in the bone marrow. Megakaryocytes in the bone marrow, they fragment and they form platelets. And the colony stimulating factors and interleukins, when you look at that, they prompt the bone marrow to turn out leukocytes and marshal up an army of WBCs to ward off attacks by enhancing the ability of mature leukocytes to protect the body. So the colony stimulating factor, when there is an infection, they start producing more of WBCs to fight the infection. Thrombopoietin, which is a hormone, this accelerates the production of platelets. But little is known about how thrombopoietin really does this. Then we look at the blood disorders, various blood disorders which goes into pathology, conditions affecting all these cells, plasma, platelets, leukocytes, erythrocytes, the major components of blood and bone marrow. The examples are various forms of anemia, inherited anemias, all these sickle cell anemia, anemia of chronic disease, cancer, whatever, acute lymphoblastic leukemia, acute myeloid leukemia, multiple myeloma, aplastic anemia, erythrocytosis, condition where a lot of erythrocytes, RBCs are produced, hemochromatosis, where the heme level is very high in the blood, that is another condition. Paraneoplastic syndrome occurs in the brain disorders, and hypercoagulable states, like when you say excessive number of red blood cells in the body. Hypercoagulable states where the coagulability is increased and they can form clots and block vessels and all that. Iron deficiency and vitamin B12 anemia. Leukocytosis, too much of leukocytes in the blood can be a precursor of leukemia from the white blood cells. Leukopenia is a condition where leukocyte is more, leukopenia means less. Then when you look at various blood disorders in the pediatrics, we are seeing several those things that enlarged lymph nodes and various of these, all these blastic leukemias are more common in pediatric this thing. And of the blood vessels, disorders of the blood vessels. Then when you are looking at erythrocyte disorders, most common is anemias of various types, congenital sideroblastic anemia, congenital dyserythropoietic anemia, megaloblastic anemia, cells become big, RBCs, but still the patient is anemic. Inability to transport so much of iron. Iron deficiency anemia, very common. In our country, most commonest cause of iron deficiency anemia is worms. That is why everyone has got to get dewormed. once a year or twice a year at least. We are doing it in schools. Then hemolytic anemia, sickle cell anemia, thalassemia, hemolytic anemia of the newborn, usually within 14 days it clears, spirocytosis, hematochromatosis, and other erythrocyte disorders can occur. Then leukocyte disorders are known as white blood disorders of the white blood cells. That's what we have seen. That is, most commonly white blood disorders are of neutrophils and the lymphocytes, the various type of leukemias and other those things. Disorders of monocytes and eosinophils are less common. Disorders of basophils are very, very rare. So sinuses, lungs, ear infections, skin abscesses, mouth sores, periodontal disease, invasive fungal diseases, infection are more common disorders of the lymphocyte disorders. So chronic disorders, lymphocytes. Then bleeding disorders. Now you have seen, due to coagulation defects, you have seen some of the coagulates found in the plasma are malfunctioned, can lead to bleeding disorders like hemophilia and von Willebrand's disease. So when you look at the final remarks, blood is a fluid in our body that maintains our life and existence. We cannot survive without blood since blood supports all our bodily functions. It is required to be in a healthy conditions. RBCs live for around 4 months, then they break down and parts are reused to make new red blood cells through the spleen. White blood cells are body markers as defenders. They fight off anything foreign, like splinter, as well as against any germs that enter our system. For every 1 milliliter of blood, there are around 5,000 to 7,000 white blood cells. When you are sick, your body increases the production of white cells to fight off infections. That is why they can get very high, 25,000. Total count 25,000. Then you have to look at the peripheral smear. If there is no infection, to see any abnormal cells or any malignancy or whatever. But most commonly it occurs in infection, and bringing down, you know that the infection is getting controlled. Blood carries all the substances that gives us energy. Blood also carries natural hormones such as insulin from the pancreas as well as growth hormones from the brain. So this is a general overview of the pathology of blood, plasma, the cells. So I think tonight, you go have a brief look about it, think and study based on what it is. Because at this point in time, this theory is important. You might become a hematologist, you will have to go deep into it. Me being a physician, bit further away as on today. But then still, all these are really very interesting. They're mind-boggling how this is happening. When you ask how the bone marrow produces all this, why, how, where, no one has the answer. That is why we still remain grounded as human beings. Wish you all good luck.